Hello.
Good evening.
Welcome to Testimony Tuesday.
Welcome once again.
We are so excited to have you joining with us on today.
As always.
Today we have two special guests with us on today, and our topic today is actually mental health. This is Mental Health Awareness Month, and so we want to bring awareness health, help remove the stigma around mental health. And so we are super excited to have you joining us on tonight.
Absolutely. Very, very important topic. Very important topic.
Mm-hmm.
So reach out to somebody and let them know that they need to hear what is going to be said today.
Absolutely. Absolutely. If you can, go ahead and like, tag, and share. Let someone hear what's about to be said on tonight.
Mm-hmm.
And so Testimony Tuesday was created to allow people to understand that God is the same yesterday, today, and forevermore. He worked miracles in the past, and he's still working miracles today. And so we take the time to share testimonies. People are able to tell you of the goodness of the Lord, what he's doing, how he's healing, how he's delivering, how he is just showing himself mighty in the present day. So it's one thing for us to read about it in the Bible and know it to be true. And it's another thing for us to see it now happening in present day. So we are super excited to share. And we have our scripture from Revelations.
Yes. And I also want to say that Testimony Tuesday, it is our desire that every time that we come on Testimony Tuesday, we want God to get all the glory.
Absolutely.
All the glory. So Testimony Tuesday is based off of the scripture of Revelation chapter 12, verses 10 and 11. And it reads, "And I heard a loud voice saying in heaven, now is come salvation and strength and the kingdom of our God and the power of his Christ. For the accuser of our brethren is cast down, which accused them before our God day and night. And they overcame him by the blood of the Lamb and by the word of their testimony. And they loved not their lives unto the death."
Power in the testimony.
Every time I read it, I feel the power.
I get so excited when I hear that, because it just shows me that there is so much power in the testimony. So
overcoming power.
Again, we thank you for joining us on tonight. We're going to jump right in and add our special guest. Our first guest tonight is Mrs. Joyce Magbie. Hello, Joyce.
Hello.
Super excited to have Joyce with us. She is a familiar face. You know how sometimes on The View they have guests that just are reoccurring guests, or they may be the guest that's sitting in. Joyce, you and Brittini are our person, so one of the ones that just come on in, but just so well versed in this topic. So I am very excited to have you. Joyce is married to Joseph Magbie, and they have two beautiful little girls.
My man.
And so it's Journey. And what's the new baby?
Jordan.
Okay. So I make sure I got it right. So
that's pretty.
Joyce is she has her master's in social work. She is a licensed clinical social worker, and she's also a certified dementia practitioner.
Mm-hmm.
And so that is really amazing. And so I want to know some more about that as well. So we are so happy to have you and your expertise with us on tonight.
Glad to be here.
Hey, Brittini. Welcome. We are so excited to have Brittini with us on tonight. Brittini is married to Mr. Jennings himself. And they have two beautiful babies. So her and Stefan have two beautiful babies. And it's Peyton and, tell me her name, Brittini.
Michaela
and Peyton. That's right. And so I think I remember Peyton so much because she was born close to Gabe. And so you'd always call her it's Payday when it was her birthday or something like that. So I just have that name stuck in my head. But Brittini is she has a master's of arts in clinical mental health, and she has her LCAS. And what is LCAS? Can you hear me,
Go
Britt?
out again?
It may have. Can you hear me now?
Barely. Yeah.
What is LCAS?
Yes.
Tell us what LCAS is. I know she's a licensed clinical mental health counselor, but she has her LCAS certification. And is that for addiction? She may not be able to hear us. It's okay. We'll ask her again later. But thank you all for joining us on today. We're going to jump right in with some questions. And so when we talk about mental health, tell us what mental health is to you. So Joyce, I'm going to start with you, and you just tell us in your own words what your definition is of mental health.
So when I think about mental health, and something that I often share with my clients is looking at mental health from a whole person perspective. A lot of times when you think about mental health, people just think about like the challenges in their mind or symptoms that they may be experiencing, like anxiety or depression. But when you think about mental health from a whole person perspective, we look at all components of someone's life that impacts them. So that can be your finances, that can be your relationships, that can be your job, as all of those things can impact your mental health. And so when I think about mental health, I look at it from looking at the big picture and not just singling out that, you know, someone may be having or struggling mentally, but they also have other pieces of their life that's affecting them as well.
Absolutely. Just thinking about it, as a whole, I just think about, like you said, just the whole well-being of the person. So when you're looking at mental health, it's their emotional, their psychological, their social well-being.
Mhm.
So I totally agree.
Yeah, when I think about mental health, it's like in the beginning, before, not like now, I'm learning a lot about it. But when I initially heard mental health, it's like my mind went to the extreme,
Right.
and it's not always the extreme
Right.
when you are taking care, like self care,
Mhm.
in
Right.
those situations that you just named.
Because when you hear it, it's always like a negative
Yeah,
thought. When
yeah,
you say mental health, you just think truth of the matter is your mental well-being is important. So,
yeah, yeah. So even having a therapist could be considered like just having a doctor going to get a physical.
absolutely.
So the mind needs a
Mhm.
physical too.
Mhm.
Yes.
Mhm.
All right. I see we are having a few technical difficulties. I'm not sure if Brittany is able to come on now. Are you able to hear us, Brittany?
She's muted.
Uh-oh. Brittany, your mic is muted.
Sorry. I said I'm trying to switch devices to see if that can help. Um, let's see. Are you able to admit me again?
I am. So I'm gonna add that one to the stage. Uh-oh. Okay. All right.
Is that better?
It
I'm
is.
sorry, y'all. Maybe it was just better to switch to the the cell phone instead of the computer. I don't know what. I'm sorry. So sorry.
That's okay. So the first thing I asked you was what was LCAS?
Okay. So LCAS is licensed clinical addiction specialist. So we just deal with a lot of addiction, substance use specifically, but it's open. It's pretty broad. Majority of my clients are, when I this is mainly substance use, but of course, you know, you can have addictions.
Okay. So in your words, what would you say mental health is?
Mental health to me is holistic. I was able to piece this and
I can't hear you, but we can see you. We can see you, but we can't hear you. Okay. All right. So, Joyce, tell us, what do you think some common misconceptions about mental health, and how can we address those? What are some common misconceptions when it comes to mental health?
One of the most common misconceptions that I hear people who's like thinking about therapy treatment or mental health treatment is that they're afraid to pursue treatment out of fear that like they're going to be labeled or diagnosed, and it's like going to follow them and prevent them from getting jobs or doing specific things. So I think that's one of the common misconceptions as it relates to that. Legally, from different aspects, certain people are entitled to certain things and to know certain information depending on what that is. But a lot of people will say that kind of like based off their religion or their friend groups or their family groups, and out of fear of that receiving mental health treatment is going to follow them and prevent them from like succeeding or forwarding in life. So that's one of the most common misconceptions that I encounter.
Absolutely. Absolutely.
So based upon the severity of the situation, diagnosis is could be a possible
Yes. So depending
based
on
upon the severity of it. So yeah,
so typically what happens, and I'm speaking from like the work that I do and have done in the past with both like outpatient and inpatient treatment. Typically what happens is when a person comes in, they receive an assessment. And that assessment allows us to gather any and all information needed. And then based off of that assessment, as a licensed clinical social worker, we are able to use our DSM, which is our tool that we kind of use to compare the symptoms that the client may have shared to a diagnosis. And so diagnoses can be anything from as simple as adjustment disorder. You can get a diagnosis of adjustment disorder from moving to a job or moving from one state to another. And so I think a lot of times people are familiar with like the common ones like anxiety, depression, bipolar, schizophrenia. And they think that the mental health is just all broad when it relates to that, but it is so many different types of diagnosis. And you're right. The diagnosis varies based off the severity and what that looks like.
wow,
But
that's
typically, it's just
very
like going to the doctor, right? When you go to your doctor, you see your doctor for knee pain or back pain. They're going to give you some type of diagnosis because they have the bill to get paid, right? And so your
absolutely
mental health is like in the same. You're going to receive some type of diagnoses because your therapist or whatever
right.
company you're working with, they have to be able to submit something to show your insurance that this is what you're working on and this is what they're treating you for.
Wow, that's some very good information.
It is.
Wow. Okay.
It is. Brittany, what do you think some misconceptions are around mental health?
I think it's a lot of course, there's a big stigma towards it. Everybody has their own input, their own interpretations. Um, they self-diagnose themselves. They rely on a lot of social media and kind of relating back to maybe personal experiences or hearsay and so forth. And sometimes I kind of misled. So a lot of times I would say dealing with community mental health, you have some people that will come in and just like, oh, I got this because this 1 minute I'm this, 1 minute I'm that, or oh, well, I got this because I just read this up online, and sometimes it could be a little bit off. But I think it could be really challenging sometimes, and I think catching off what Joyce was saying, I want to kind of add on to that when you like if you were go to a hospital or inpatient facility, they attach a diagnosis to you for billing. And oftentimes some people will kind of hold that and stick to it. Well, my paperwork says schizophrenia, or my paperwork says I'm bipolar. But a lot of times a lot of times when you go in inpatient, sometimes not all facilities, they'll assess the crisis, what you have going on. They're not really digging deeper to kind of identify the trauma, because a lot of the symptoms that could pertain to the trauma may be closely related to other diagnoses. And at that moment, they're just trying to treat that crisis. And then they send you to outpatient. And that's where we kind of work a little bit more one-on-one and dig a little bit deeper, get a little bit more information. And I feel like that helps. But you have some people that will stop there and just kind of take the paperwork and like, oh, this is what I have. And they kind of just stick to it and don't really follow up with a lot of the treatment or try to get a better understanding or try any coping skills, or if medication is available, they may or may not take that route. So I feel like a lot of people will overlook a lot of things for the fear of being medicated per se, or being attached to that stigma of, something's wrong or something's different. And they may not know anyone that they can relate to, they can kind of identify with. So they sometimes feel isolated and prevents them from kind of continuing the treatment sometimes.
Wow.
That is so true. And people just have a hard time taking medicines. And so it's I can't even explain it. It's almost like, if you have an infection and you need an antibiotic, unless you take the medicine, it's not going to clear up. And if you take the medicine for a short amount of time, it hasn't completely eliminated the infection, and then the infection continues on. And so I feel like for some of our patients, they don't want to take the medicine. And so those very symptoms are right back even more aggressively because they don't want to take the medicine. So tell me, what are some strategies that people can use to manage stress?
I can go first. Can you hear me?
Yes.
Okay, because I have some issues here later, making sure. Stress is something I always tell a lot of my clients. Stress is something that everybody will deal with at some point in time. No one is exempt. Stress affects us differently. We learn to handle it in healthy ways and unhealthy ways, of course. Sometimes we are not privy that some of the routes that we take or coping skills that we take are not the best choices for us at times, because we feel like it works at that moment. So, of course, you have like deep breathing, of course, when you look on TV shows and things. It's like, oh, just inhale, exhale. And it's like a lot of people will go to things like that for meditation, and they're expecting the situation to be resolved. But we're looking for something that kind of help decrease the stress level some, so we can function and make wise decisions to move forward. Managing, making sure we're not stretching ourselves too thin, trying to eliminate some things off our plate, but making sure that when we eliminate things off our plate, we don't automatically fill it back up with something. So if we are just really overwhelmed with a lot of tasks, and it's like, okay, so I'll use you, Miss Lewis, as an example. Okay, I'm done with school. That's off my plate now, breath of fresh air. But before we know it, we picked up a whole nother task to fill that spot. And we don't realize that, okay, I just put myself back into this high stress level. There are a lot of stresses that are in our control, and there are just as many that are outside of our control. But having someone to talk to, whether it's a therapist, a family member, pastor, a friend, someone that you can confide in to talk to, because talking really does help. Journaling are things you can do with your own, something to kind of distract your thoughts. And again, these stress tactics that you use, they aren't there to fix the problem. They're just kind of help you to reduce the stress. And I think a lot of times we don't take these routes because we want the problem to be fixed. We want it to be over with. We want a solution right away. Exercising, going for walks, taking time throughout your day. I'm really big on, for those that travel to work, I think it's important. I always kind of use that transition time. Take that time. If you have a busy day, you got kids, you got a family to take care of, the time we transition to work from home or from home to work is very, very helpful. Taking that time to just kind of let yourself know, like, okay, I am not at work anymore. My stresses that I have been dealing with at work, that chapter is closed. I'm moving on and transitioning to home. Sometimes that transitional period really does help. But just taking time to make wise decisions, doing things that make you feel good, that reduces stress levels, that's enjoyable. But sometimes we don't like to take time to relax because we have so many things to do. But that relaxation will help us become more effective in other areas too. So.
That's good. That's good. And it's so true because I am trying not to fill my plate back up. So, Joyce, what do you say?
Brittany hit the nail on the head. If I could add anything, it would be like to be intentional. Um, like for me, for example, working from home, it's so easy for me to sit at my desk all day, eat, eat lunch, eat breakfast while just sitting there and not being intentional about stepping away, even though I'm at home. So that may be like getting outside for 15 minutes, taking a walk, breath of fresh air, just walking to another room. I think being intentional along with being using mindfulness. So trying to remain present in the things that we do as it relates to reducing stress, and then also implementing boundaries. Just implementing boundaries of learning to say no. Again, like Brittany shared, what's on your plate? What can you take off? What can you deviate to someone else can also help to reduce that stress.
I so agree with both of you all. I think one of the things that I like to talk about is the mindfulness piece of it, because a lot of times we're so bogged down with what's going on in our lives that we don't take a moment to just put ourselves in the present moment. And so we're so busy. We could be sitting here at home, but our mind is in 1,000 different places. And so I like to do mindfulness techniques with clients to just put them in the present moment. And some of the times we're sitting there and it could be just like the five senses where you're able to recall different things with your senses. And I can remember this lady sitting there and she's trying to find 5 things that she can see, and she's looking everywhere else, and right in front of her is a cup. And so, but when your mind is just in so many different places, you miss what is right in front of you. And so that is huge. And then someone just said they struggle with saying no. And that is,
Yes, that's a big one.
that is a huge one.
Yeah.
Pastor Hargrove, I'm guilty of that so much too. I've done a little better, but it is hard because, sometimes we try to be everything for everybody and we lose ourselves in the midst of it. And so it is important to be able to say no. And I can't attend, or I can't do it today, or not to even overextend yourself. And I can remember just asking June, it may be a Friday, and I'll say, well, what do you have to do today? And he says, why? Immediately, because he thinks that I am about to fill his plate. And so if he tells me, well, I don't have anything planned, and then I immediately say, good, because we are not doing anything this weekend. But that's a good moment. And now some of our weekends from Friday to Sunday, it is filled. But I am trying to be more mindful of those things and having the moments to just breathe and exhale and all of those things. So very good, very good.
And what happens too with saying no, I always encourage my clients, like saying no, like you said, it's not a bad thing. And 9 times out of 10, you tell somebody no, they're going to figure it out and get it done anyway.
Right.
So you saying no is not going to stop their party. They're going to figure it out. They're going to ask somebody else. And so like you said, it's okay to say no, be in tune with yourself. How much can you take on? How can you feel? It's like you said, assessing your family situation. What do we have going on as a family? Because if you don't have nothing to do, I'm not going to fill my plate either, right? Being intentional about that time.
Right.
And no doesn't require explanation. A lot of times we feel like we explain why. No, I can't because, well, that's not really necessary, because a no could just be no, I can't. You're not obligated to give an explanation. Sometimes we feel that we need to give that explanation to satisfy the other person, but sometimes you don't have an explanation. The answer is just no. And we should start to be a little bit more comfortable saying that. It's not easy. I know I struggle with it with certain people. Now, there's some people I don't mind saying no to, but there are some people that it's just like really hard. But you have to put yourself first.
Yeah, we learned that your friends won't require an explanation, and your enemies don't deserve one.
Oh, that's good.
Yeah.
So true. Brittany, that's good, because I'm just sitting here thinking, like, for certain people, it is so hard to say no.
Your list is just so long.
So I got 6 people to work on with the no.
Yes.
Okay.
Yes.
So tell me, how do you think social media has impacted mental health? And what can people do to cultivate, like the healthier relationships there? What do you think social media's part in our mental health is? Either one of you.
Go ahead.
I think it really depends, honestly and truly, on the generation. You have some people in certain generations that social media does not affect them. They don't like it, don't want their picture on there. They don't understand why. Some people are on it as much. And then you have some people that really enjoy social media. But we actually had a discussion about this in one of our groups this week, talking about how social media can affect mental health. But I think the number one reason I've heard a lot of people mention this week alone was the comparison.
Mm.
I should have this, or how does all good things happen to them, or why does anything like this ever happen to me? And regardless of whether we say this with our mouths or not, a lot of times some people will think it or have that thought. And it could become discouraging. It could lead to negative self-talk. It could lead to, envious, jealousy. It could affect someone who may be battling a lot of anxiety and depression. But don't get me wrong, all social media isn't bad. And I feel like you are the one to determine how it affects you. You need to become aware of this. And, some strategies and tips could be, kind of go through your friends list. If everything you see on there is negative or a lifestyle that you're no longer wanting to live, they have a few clicks on there, block, remove, delete, all those features that are in your control. And that can really dictate, how often certain posts that, that may be triggering for you or that may bring about bad emotions or feelings and such. But I would say for like younger generations, our youth, it could be a really tough battle for them because they kind of grew up with social media. Like this is all they know. This is the way of the world. Everything is on social media. They're role models of social media. So sometimes it could kind of give that portray that life is just so perfect and glamorous and you should have this and should have that and can really lose sight of yourself and the goals that you're working towards. So I feel like that is kind of based on an individual basis because you have some people that it may not affect their mental health and then you have some people that it really does take a toll. So I think if you start to feel any symptoms as far as like within yourself, I mean like negative thoughts, feeling discouraged, feeling hopeless, and maybe getting on social media doesn't necessarily help, then maybe we should take some breaks. I'm only social media on certain times of the day, or if I feel this way, maybe I won't rely on social media. Maybe I'll look to do something else. If I find myself doing too much screen time, then maybe I need to try to incorporate other activities.
I think that's good. I think that's really good. And I think you hit something that's so important. Part of people's problems is that they're comparing themselves to other people. And that is such a hard thing. You look at so and so and you think they're successful, or if today somebody bought a new car and it's like, well, when is this going to happen for me? But the thing is, you never know a person's struggle. So you never know what they had to go through to get to where they are. And so you should never look at someone else's life. It's okay to look at someone and say, oh, I admire this, or, if they're doing positive things, but it's never good to just envy or want what someone else has based on a false perception that you have. So I think that's important, but go ahead, please.
And I was just going to say a lot of the work that I do is to, like Brittany mentioned, like if you find yourself like comparison and becoming jealous, to a lot of internal work, right? So one of the things that I have my clients work on, especially those that find that they're comparing themselves to others and what they see, is to challenge that too, right? Like you mentioned, you never know someone's struggle or what they're going through. And so, for example, you see someone post they're about to get married and you may have the desire to get married and it's not happening for you right now. instead of looking at that post, becoming angry or upset, like challenge yourself to say congratulations, right? I always tell people to think about it. If that was you in that situation, what would you want from people? Because you're posting it for a reason, right? You're posting it for congratulations for people to see. And so I always challenge my clients to put themselves in that position, right? And so until your time come, until your moment come, give unto others, right, what you would want at the end of the day if you was in that same position. So I think it's good to challenge yourself to getting off social media, regrouping. That's important and great, but sometimes it's okay to challenge yourself because people are not going to stop posting, right? And some people feel like they just can't live without social media, so they're always going to be on there. So I say challenge yourself to kind of push through those feelings as well.
I think that's good.
Yeah, and also concerning Facebook, social media, so to say, I believe I always heard that misery loves company. So whatever type of energy or whatever type of vibe that you are participating in, what you feed is what's going to grow. So if what is being shared is not positive and not adding any type of encouragement to anybody's life, then I think it should be, looked at, because there are a lot of people out there that really need they need counselors, just to talk to. So, but yeah, it's the type of energy, and you find what you look for. Yeah.
Brittany, were you about to say something?
No, I agree. I was just
Yeah. I think that's important. And so we have said a lot. So, like, I think you all have touched on so many topics and so many parts of mental health. How important is medication?
all yours.
You say all me?
All yours, Joyce.
So it varies. It varies, right? It depends. When some clients start therapy, the recommendation may be a referral to a psychiatrist or even to their PCP to get medicine. Sometimes clients come already getting medications from their providers and wanting to add on therapy. You may hear a lot of people say like therapy and medication management works best together. And that's for some people. Some people can do well with just therapy alone. Some people are referred for medication and won't take it due to religion, due to stigma, or legitimate reasons like side effects, past history. And so while medication is important, I think it really varies based off the person and their need and their experience. But it is said that medication and therapy works best together if needed.
Yeah. I think it's the same thing. Like it's really a case by case basis. Of course, every person that I see may not be recommended for medication. Every person that's recommended for medication may not comply with it for reasons as such. And I think it really on how what the medication, what are we taking the medication for? Is it something that you can, you feel that you can work through the therapy? Is it interfering with your eating, your sleeping, your day-to-day, your functioning? You're able to function at work, school, with family, with others. I feel like that's a different conversation depending on how those mental health symptoms are affecting your day-to-day. But of course, we have our different views as far as medication. I have never been the one to really push or go against anyone's views. I just help them explore, what are the challenges that you're facing, what prevents you. Oftentimes I hear a lot of people say, oh, well, I had a cousin that had some medicine years ago, and ever since he started taking that medicine, he ain't been the same since. And like that probably was like 30, 40 years ago. And they have their reasons as to why they don't want to give it a try. And I respect that, but I will oftentimes will kind of encourage, well, would you be willing to talk with the doctor? They can answer all your questions, concerns you may have. And of course, at the end of the day, it's up to you if you choose to get the prescription or not. So I still let them know they have that option, but possibly wouldn't hurt to become educated on it just a little bit more. because I can't give any medical input and I can't answer their question. But maybe sometimes that is a start.
That's good. That's good.
In the event that someone is diagnosed and they have to take medicines, what are the chances that they can overcome that hump and not have to take medicine again? Is it possible?
So it's kind of in the same, like you treat your physical health, like Minister Ayana said earlier, right? With the antibiotics example, you take it. If you stop taking it before it's time, symptoms are still there. And so it's still the same, right? You can start therapy and medication. With that management, your symptoms improve and your doctor can taper you down on the medications to the point that you no longer have to take them. You may have to take them as needed. So it kind of aligns the same with like your physical health. You go to the doctor, you have high blood pressure, they give you medicine, you start eating right, you start exercising, your blood pressure decreases, you no longer need medication. So that's the same way with mental health. Go see your therapist, you take your medication, you start using your coping skills, implementing the things that's taught in therapy, your symptoms start to decrease. Your medications may start to decrease. Your frequency of needing therapy may start to decrease as well. So it kind of aligns the same.
Wow, very good.
That's good. That's good. I think now to look at like my final thought would be around mental health in the workplace. And so a lot of times you see a lot of people some people love their jobs, they're the best jobs, and then some people feel really, really stressed at their jobs. And so I've heard both sides of it. What do you think workplaces can do to promote mental health?
I think incorporating mental health days and not attaching them to sick days could be important. A lot of that time, because you can burn out very easily, especially regardless of the role that you have. Everybody burns out at some point in time. But a lot of times, if someone takes a mental health day, they usually have to use a sick day. Well, I personally don't feel like that should be the same because I may not be sick. I may not have a doctor's appointment. I just need a day to kind of get myself back together again, or just a day to rest, or just to decompress all that's on me. Allowing that, of course, open door policy, and I know that's like touch and go for a lot of different companies and places. But having a buddy system or someone that you can really confide in, should you have to. If something isn't going right, or even down to having someone speak and say good morning. Hey, how's your day? Is everything okay? That way they're open and extending the option to say, if things aren't okay, or if they normally come by and speak to you, they can kind of tell by your mood, is everything okay? I noticed the last few days, you haven't really been yourself. Here, if you need it, you need a little extra time, you need a longer break. What can I do to help? And so forth. And just kind of giving someone that option, whether they decide to take it or not, but just letting them know that it is there. Reminding them of the, oh my God, it's on the tip of my tongue. Joyce, I forgot when the company will pay for the mental health.
Employee assistance program.
Yeah, that's it. Employee assistance program. Reminding them that those are available if it is available at the job, because a lot of people are not aware. They don't think that that's available. They don't know that they have the option. And I understand some people are very private as well, or at least having different resources. Maybe after meetings or staff meetings, just kind of having flyers up, because some people may not want to come to the supervisor's office or in front of everyone to grab a card or something like that. But just having it where someone can easily grab or take a picture or get access to to that program, or to therapists in the area, or mental health or behavioral health facilities that are locally.
I think that is, hold on. I think that is so good. I saw where one of the schools had, I think it was during Teacher Appreciation Week, but they had like a massage therapist to come into the school, and the teachers were able to go into the lounge and get a massage. I thought it was because right now teachers are about to tackle those EOGs. They're on crunch time. The kids are really trying hard they're pushing them really hard now, and it can become a very stressful moment. And so I thought that was great for the school to do that for their staff. Joyce, what were you going to say?
I was just going to piggyback off of the employees assistance program, because I'm actually an employees assistant program counselor. And so that benefit is something that is paid by your company. A lot of people have it and are completely unaware about it. So it's a benefit paid by your company, which allows you to receive mental health counseling. And some companies have other services as well that they pay for you. And what that process typically looks like: you reach out to your insurance company, you get in contact with their behavioral health department, you let them know that you're looking for a counselor, and let them know you want to explore to see if your job provides free counseling through the programming. And then they will provide you with that contact number. You make outreach, you speak with the intake counselor, they gather your information, they do their quick assessment, and then they can set you up with a certain amount of counseling session. And that is completely based off of what your employer purchased for that. But it is a free service. And typically what happens when people complete that short-term focused counseling, then they're able to get a referral for long-term counseling. And also, like you mentioned too, I know with my job with the Employees Assistance Program, we have wellness breaks. We have mindfulness sessions throughout the day where we can join in a particular classroom and do yoga, mindfulness. We have therapy sessions where they come in and provide that. We have people to come in and cook and different things of that nature. So I think, again, that's another piece of breaking the stigma right around the workplace, being afraid to outreach the services. I hear so many times when my clients call in saying, is my job going to know about this? Or I don't want anybody of my job to know about this. And of course, with confidentiality, depending on the circumstances they want. But I think just that stigma of having that resource available for free and people being afraid to use it out of fear that others are going to find out.
So I think that's a key thing for people to know, that those programs are confidential. And so it's not like they're going to call back and say, hey, Brittany fussed today about the job. He complained about, whomever. It is confidential. So I think that is important, and it's a free resource that people can take advantage of. And I think that is wonderful.
Depending on the situation.
And so
there you go.
Like it's a threat.
Right.
If they're a threat to themselves, if they're a threat to others, then we're obligated to share. And so, or if it's like abuse in some, you're obligated to, inform. So, but really it's confidential.
And even in that though, I think before we, make reports or call, we let them know too. So it's always a bridge of communication, right? We just don't be like, oh, they said they're thinking about harming themselves. Okay, well, let me just call. Like I let them know, like, hey, you mentioned this to ensure your safety. These are the next steps I'm going to take. So even in the confidentiality piece, we still keep our clients informed of what we're doing, because it's still a part of their treatment at the end of the day.
Yep. Very good.
Yep.
Wonderful, guys. I think it is so good. So when I look at our takeaways, so when we are talking about mental health, we're talking about your emotional well-being, your psychological, your social well-being, and of course we want to reduce the stigma. And it is important. I think it was Brittany that talked about being able to exercise and eating and all of those things, because I'm a stress eater. So when I feel stressed, I'm overeating. And so, but anyway, just working on some coping skills. So as we are closing out today, I want you all to just close out with a coping skill that people can use, just a simple coping skill if they were angry or having a very stressful moment, just a coping skill that they could possibly use.
Okay.
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 You talked about the grounding technique, the 5 things, the 5 senses. That is a really good one to use, and can be done anywhere. Um, and it's just basically kind of using your 5 senses. You know, the 5 senses, and you just kind of count down. So 5 things I could see, 4 things I could touch, 3 things that I could smell, 2 things that I could hear, 1 thing that I can taste. And that could be like some gum or a peppermint or something to drink or anything like that. That kind of helps you stay present. And I think that could be done without anybody knowing what you're doing. If you're angry, frustrated, it just kind of brings you back, centers you a little bit, helps you make those smart decisions, making sure we're acting out of a wise mind instead of an emotional mind. That could just cover areas: anxiety, depressive thoughts, anger, frustrations, anything like that. So that's that. I kind of want to throw that one out there. That was really good.
Mhm. I love mindfulness. I do. I love the grounding
Yeah.
technique. Joyce?
For me, so I know you said coping, but I want to talk about going like into self-care and back to like being intentional, right? And so that may even look like starting your day 15 minutes early, to get up, have that quiet time, to journal, have that coffee, being present, not distracted about what you're going to wear, what you're going to do. And the same, right? End of your night 15 minutes later to decompress, to journal about your day, to have that time to drink that water, or eat a late night snack. Because I think that's equally as important as coping as to take care of yourself as well. So I think that's something that I kind of talk with my clients about that they find helpful as it relates to being intentional about themselves.
I love that. I love that. And I'll share just something simple. Before you respond, you may take a moment to just in your head, before you
Mhm.
respond to a stressful situation, count down from 10 to
Mhm.
1. And walking is another one. I tell people listening to music is also a good coping skill. However, it is important to make sure you know what you're listening to,
Listening to.
because if the music makes you feel further depressed, you know, that's not what you should be listening to. So making sure that it's something that uplifts you. I always use the example: if you have just broken up with your boyfriend, you're feeling depressed, you're having a moment, Mary J. Blige, I'm Going Down is not the song you because it's going to take you further down.
Damn, you're going all the way
But
down.
you just found something that's uplifting to help lift your spirits from that place. And so, just very important. Just very important to make sure you know what you're listening to.
What about if you're gonna go, baby, go ahead and walk out the door?
That is a song.
That might work. Wow. This is so good. This was so
It is
good.
really good.
Yes.
It's really good. And it's so important and
Yeah.
it's so needed. And in school, we always learn that every therapist needs a therapist. And so that is one of the things. So you have to have an outlet. You have to have somebody that you can talk to, that you trust, that you're able to share different things with. One last thing, we talk about church and mental health. And I know they're doing like a lot of different sessions now to kind of, especially in this area, to kind of bridge the gap between mental health awareness and the church. And a lot of times we're taught God can fix it, and He can because He's God. However, He has put people in places that are able to help you all. And I often give the example: Luke walked with Jesus, but he was a physician. And so, he puts people in places to be able to help people get what they need. So, just very important to make sure you have someone that you can talk to. I think it is important.
Yeah.
Thank you
Yep.
guys
And I
so
don't know.
much.
I don't know if my director is watching, but I'm gonna look into the employee assistance program.
Yeah. Yeah.
Okay.
And most
Yeah.
jobs have it.
Yeah.
And people just don't. They're really sitting on a free benefit and
Yeah.
really don't know it.
And
Definitely
a
call
lot
me.
of times, they're sitting on that benefit and they may even have a counselor outside that they're paying.
Yep.
And then you have this
Mhm.
benefit for free. So
For
that's
free.
very important.
And
Thank
sometimes
you,
too, I want
guys.
to highlight with the EAP, depending on what your company purchased, it covers people within your household too. So, for example, if Brother June, your employer has it, and they may qualify Minister Ayana to get the same service with a different counselor, of course, a certain amount of sessions. So that's something to add too. So if you have family members within your household as well, when you reach out to the Employees Assistance Program, ask them who is covered under your plan, because you can have family members as well that's covered for free.
Okay, very good.
That is wonderful. So,
Yeah.
guys,
Yeah,
if you're
very
watching today, go out, find out.
Yep.
Call your human resource department,
Yep.
find out.
Call that number on the back of your insurance card.
Oh, it may be up there.
Yeah.
Yeah. But it's important. So, guys, thank you all so much for watching. We have Joyce and Brittany. Thank you all so much.
so
Y'all
much.
are amazing.
Yes.
Mhm.
you are.
One day
We're glad to have you on board.
Yeah.
I'm glad to be on board. I'm so excited. I am so excited. When I passed my test, Brittany and Joyce were the ones I called to say, "Oh my gosh, I can't believe it!" Because I couldn't believe it.
Yes.
See the glory.
Yes.
I'm so excited. So we'll have something else soon. I'm gonna give you all a better notice with what's to come. So,
Look at Brittany.
Brittany, I'm gonna try.
You're one of those people we talked about, the ones that you can't say no to. That's you.
Don't y'all work on saying no to me, though. I so appreciate y'all so much. I can't post comments, and I was trying to. Some of the comments I was able to post, but some of them I cannot. I just can't post anymore. I don't know why, but Devontae was watching. He said that was very good, Daddy, and Keisha Douglas said that this was very informative. Tammy says being around the right people is a must. And so Michaela Jennings is watching, just FYI. She said, yeah. And so they said, great job, guys. So thank you all so much, so much, so much. Where can they find you all if they need to? Do you all do independent, or is it just through?
I'm like, so for me, I am not within a private practice right now.
All right.
So again, my work is through the EAP. And so we do service like Durham County schools and stuff like that. So it depends on your employer and which EAP program that they have. But like, you can't contact me and say, hey, I want Employees Assistance Program. Unfortunately, I'm not in that arena right now, but
gotcha. Stay tuned.
Market services. I do group therapy, individual therapy, and that's of course like Henderson. But the private practice is in the talk, so stay tuned. Things in the works. Excited.
Yes.
But yeah, I am. I do have my caseload is getting pretty filled up, but you're more than welcome to come to Daymark. I'm not the only clinician there. We have some amazing other clinicians there. If I'm unable to see you, and of course, in that Daymark Recovery Services serves as a walk-in facility, so you don't have to have an appointment. You come in, you have an assessment done, and based off the clinician and what you've shared, they kind of connect you with the therapist from there. But yeah, that's how you can find us. But stay tuned, be on the lookout. Sounds like we got some good things coming.
I know. I'm super excited. We're gonna see where I fall in the mix of all of this. We're gonna see. Guys, thank you so much. Thank you for joining. Thank you for joining. If you have any questions, you are always able to reach out to me. And most people know how to contact me, but you can hit me in my DM, if you have any questions. But mental health is important, so don't play with it. Thank you all so much. We appreciate you for watching tonight. Good night.
Good night.